Hey everybody, happy Hanukkah, and here's the news right here. Pretty exciting. Uh, like that. Boom. It says U.S. Advisory Panel recommends approving Pfizer's COVID-19 vaccine for emergency distribution. And what that means, well, it's played right here.
Are the following, and we should make the point. These are concerns, and there's always a concern about any sort of a drug or a vaccine. But the concerns are about 16 and 17-year-olds in particular, about adolescents. They want more studies on the effect of this vaccine on teenagers, on adolescents, also on pregnant women. Some discussion about those two cases in the UK where people had significant allergic reactions to the vaccine, but only two that we're aware of in an anaphylactic type of reaction. Some concern about doing more research on that. And then also about whether they should stop the placebo, those folks getting a placebo in this ongoing study. Stop that. Give those people the vaccine because, of course, it works. If you do that, though, then you undermine your science that you're continuing to try to pursue with the placebo and the full study. The bottom line here is that this vaccine is going forward. Americans are very likely to start getting vaccinated within days now.
All right, Tom, thank you. Let's pick up on that point. I'll bring in NBC Chief Medical Correspondent Dr. John Torres. John, what other steps need to take place before people begin rolling up sleeves?
So, Lester, like Tom said, the VRPAC, this committee met, they're advising that they go ahead and forward with the emergency use authorization. The FDA will now look at that, take that under advisement. Most likely, most experts predict they're going to go ahead and get that emergency use authorization. They're going to approve that. But then the next step is the CDC meets. They have an advisory committee called ACIP. It's the Advisory Committee on Immunization Practices. They're going to meet, and they're now going to go ahead and recommend who gets the shot, how much dosing they get, the interval between the dosing on that. They're going to make those specifics. Once that happens, the CDC will take that under advisement and most likely go ahead and recommend that as well. And that's when shots in arms will start, because now the authorization looks like it's going to go through from the FDA. But now after that, we're going to get clinicians out there wondering, okay, how do we do this? At what dosing? That's where the CDC steps in and gives them that information, Lester.
Dr. Torres, thank you. With today's recommendation of approval, and again, it's not the final approval, but Pfizer now faces the enormous task of manufacturing and distributing its COVID-19 vaccine. Gabe Gutierrez is at Pfizer's biggest manufacturing plant in Portage, Michigan. I know they have been waiting for the final go. It appears to almost be here. Walk us through what happens.
Yes, Lester, as you mentioned, this is the largest manufacturing facility for Pfizer, and it is at the ready. As Tom mentioned, within 24 hours or so of final FDA approval, the plan here is to begin trucks rolling out to different airports, and FedEx and UPS are essentially supposed to split the country and distribute this to many parts of the country. But, Lester, it's an astounding logistical challenge because this vaccine needs to be stored at 80 degrees below zero. Now, states will get an allocation of this vaccine initially based on population. A large state like California, we understand, getting more than 300,000 doses. Smaller states getting about 5,000, at least initially. And while the timing of this is extremely fluid, we understand that some hospitals across the country are preparing potentially to get their first doses as early as Monday. Lester?
Wow. Hey, so
All right,
folks,
Gabe
as early
Gutierrez,
as
thank you. All this coming at a critical time for this country's healthcare system.
as early as Monday. And meanwhile, we've got on MSNBC, they're talking about Trump here. Let me, but I want to respond to some of your comments. Fierce Raider says the vaccine is the mark of the beast. Get this, Mom. This says the vaccine is the mark of the beast. And if you're a true believer in this vaccine, else you will receive eternal damnation of the lake or fire. That's what he's... I don't know who this person is. It's got to be a joke. But it's... Fierce Raider, let me tell you something. Anybody out there, look... if you're used to taking aspirin or Tylenol 8, I'm on medication, you're going to be just fine. And I don't know where all this anti-intellectualism is coming from with respect to taking a vaccine that's supposed to help you survive, in this case, a very crazy virus that no one knows where it came from. You know, great. Let them, don't stop them. All right, do it. But to write that, I mean, I'm like, oh, come on, give me a break. Hey, folks, if you're watching this, you can't see what I see, and I'm using Prism, by the way, and it's allowing me to see what people write on the live stream, which is, here, right? Hey, wow, everyone, but that's the beauty. And Greg Lone Dot says, I'm excited to see this finally happening. What do you think of the vaccine, Mom?
But the problem with those kinds of things is what you say on television.
Anyway,
protected by the First
folks, I'm going to take this discussion up a little later, or at least continue it a little later. But make sure you subscribe to Zenny62 and bookmark OaklandNewsNow.com. And hey, you know what? I'm going to have a virus live stream part 2, so we can talk more about this. All right, I'll see you. I'll be back.